Well, if you're in need of a doctor, it's never a good idea to delay medical attention. Emergency rooms and urgent care clinics are safe places to receive health care right now.
Here to explain, Dr. Richard Logue, Regional Medical Director of Emergency Services with HCA Houston Healthcare, and Dr. Michael Kaplan, Market Medical Director with HCA Houston Healthcare's CareNow Urgent Care. Doctors, welcome to both of you. And Dr. Logue, I want to start with you. Let's talk about just how extensive this network is. There are so many different options for people to go and get care when they need it.
Yes. Well, first, thank you for having us on today. Yes, we're very proud to say that HCA Houston Healthcare is one of the leading providers of healthcare in Houston. In fact, we actually treat almost 1 million patients a year.
Wow.
And we're big, and we cover 13 hospitals. We've got 10 outpatient surgical centers, 11 freestanding emergency rooms, 16 CareNow urgent care centers. And a lot of people out there may know some of these hospitals by their individual names. Places like Clear Lake Regional, Conroe, Tomball, Women's Hospital, Texas. But recently, understanding that, we united under the banner of HCA Houston Healthcare to kind of allow people to understand the power of the network, the size of the network, and it's something we're very proud of.
And you should be proud of it, too. And I know we were talking about this in the intro, that so many people during this time, of course, we're dealing with the pandemic. Things are starting to open. We are trying to get back out. But the important thing is here, if somebody needs medical attention, they need to get to a doctor. We can't delay that. And Dr. Kaplan, that's, I think, the thing that we need to really stress to people is that people can receive health care now, that they can go out and see their doctors.
They can, and it's safe. Safety of our patients is the #1 priority. For us, it all begins with screening. Patient screening occurs at all our clinics, for all our patients, for all our visitors. And it's to recognize and prepare for those most at risk for COVID infection. In addition, all our clinics are thoroughly clean. Social distancing practices are in place. Limits to companions, visitors are adhered to, and most importantly, universal masking is required for all patients, visitors, staff, and of course our providers.
Masks are required. And Dr. Logue, we heard Dr. Kaplan just say safety is the #1 priority. Some people out there, I'm sure you've probably heard this from folks, they're nervous that by going to, to see their provider that they could contract COVID-19. What would you say to folks who fear that?
Well, it's one of the main reasons we're glad to be here today is to get out to the community and kind of express to them how safe the hospitals and emergency rooms are designed, including the urgent cares, to receive patients. We actually, HCA Houston Healthcare started as early as like January to begin to prep for COVID and ensure the safety through such things as adequate PPE, universal masking policy, which Dr. Kaplan alluded to. We've actually gone so far as to design separate entrances, so for staff and for patients, and we limited visitation to kind of limit exposure. Further, what's actually very great about HCA is we were very thoughtful about cohorting the patients, meaning if a patient needs to be admitted, for example, the COVID positive and the presumptive positive COVID patients are isolated away from the non-COVID patients, thus making it an even much safer place to be. We either did some extra measures for those clinicians that were taking care of COVID patients that were known. We provided clean scrubs with every shift. We actually, even for the staff, some of them were scared about going home and exposing their families, not understanding, especially when this began, a lot of the unknowns that were around it. So we provided temporary housing through some of the hotels in the region. So we put a great amount of effort into it, and we're very proud to say that we feel our emergency rooms and hospitals and other areas are safe.
It's fantastic to hear all of the safety measures that are in place and have been in place during this time. Dr. Kaplan, when should patients seek treatment at the CareNow urgent care locations? What are we talking about as far as when they should come in?
Well, as opposed to our great HCA emergency room colleagues like Dr. Logue, who treat life-threatening and limb-threatening emergencies, our urgent care CareNow clinics treat minor or moderate medical illnesses and injuries. on a walk-in basis, 7 days a week. We also have the added convenience of web check-ins, and we recently introduced telemedicine visits to our market. And of course, we treat all patients with symptoms that are concerning for COVID infection.
So non-life-threatening things. And doctors, we are over time. So very, very quickly, Dr. Kaplan, when should folks go to see, to go to the emergency room, essentially? I saw chest pain on that list we just had on the screen.
Yeah, again, for our ERs, the most important, they treat the life-threatening, limb-threatening emergencies, chest pain, severe bleeding, severe shortness of breath, those types of emergencies.
Dr. Richard Logue, HCA Houston Healthcare Regional Medical Director, Emergency Services, and Dr. Michael Kaplan, CareNow Urgent Care Medical Director. Gentlemen, thank you so much for joining us today, covering this topic that so many of us need to hear about. And for more information, you can visit the website hcahoustonhealthcare.com.
And we'll be right back.